Hi, I'm Amy Goll with the Power to Protect New Jersey campaign. This statewide program is coordinated by the Partnership for Maternal and Child Health of Northern New Jersey and funded by the New Jersey Department of Health. Our objective is to bring awareness to all residents of our state about the importance of getting a flu shot this year. With adults and many children becoming eligible for both the COVID and flu vaccines, we've had many questions, so we decided to reach out to an expert. With me is Dr. Jeffrey Bienstock, a board-certified pediatrician who practices with Pediatric Care Associates in Northern New Jersey. Dr. Bienstock, a fellow of the American Academy of Pediatrics, is the president of the Northern New Jersey Pediatric Society and former president of the New Jersey State Chapter of the American Academy of Pediatrics. He is the president of the Board of Trustees for Healing the Children, New Jersey, and its medical director. Dr. Bienstock has helped lead international medical missions. He has had numerous recognitions throughout his career, and most recently was named New Jersey Pediatrician of the Year and was a recent CDC Childhood Immunization Champion. We are also proud that Dr. Bienstock serves on the Board of Trustees for the Partnership for Maternal and Child Health of Northern New Jersey and is an active member of the New Jersey Influenza Action Group. Welcome, Dr. Bienstock, and thank you for joining us.
Thank you very much for the invitation, Amy. I look forward to speaking with you this morning.
Okay, so here are some of our questions. I've heard New Jersey had a very mild flu season last year. Is it still important to get a flu shot? Why?
Yes, first, we did have a very mild influenza season here in Jersey as well as throughout the country. Part of the reason was the twindemic that we saw, which included COVID as well as influenza. People were masked, people were washing their hands, and people were socially distant from each other. And I think when you combine those two together, we had a much lower rate of infection, one of the lowest that we've seen probably in the last 12 years. Because this will be a different season as we go forward, and we know each year is just a little bit different, and masks are not always on. Some people are letting down their guard. It's very important to remember to vaccinate and to remember to get your vaccine for the influenza as early as possible.
Is it safe to receive both the COVID and flu vaccines on the same day?
If you had asked me that question several months ago, the answer would have been different. Right now, the CDC, the ACIP, the FDA is hoping that people that are eligible for both their COVID and their seasonal influenza vaccine will get them together in tandem, one on each arm.
And what about side effects? What can I expect as far as side effects go if I'm getting both the vaccines?
Well, I think the biggest side effect is protection. Well, it's not truly a side effect, but it's a true benefit. We know that anytime you have an injection, whether it's the influenza vaccine, HPV, Tdap, MMR for children or even adults, there will be some soreness. So we expect that there will be a sore arm. We have seen with the COVID vaccine a little bit of swelling of lymph nodes in the axilla, in the armpit. That is the reason why the recommendation for this year is to get the COVID vaccine in one arm and the seasonal influenza vaccine in the other arm, knowing that there will be some side effects causing some pain, induration, as well as just some malaise, not feeling well, a little tired, maybe even a little low-grade fever. But we must remember, you are not contracting illness when you receive the flu vaccine. We know that this is a killed virus. This is not a live virus. So people that tell you or tell me in the office, Dr. B, I got the flu last year from the vaccine. No, you had a side effect. This is something that we expect to happen.
I was just going to ask that very thing because it popped into my head, but thank you for preempting that. If I get both vaccines at the same time, will they still work as well as if I got them each separately?
Yes, they don't interact. And one of the most important things that we can do is to be vaccinated. I have lots of friends that are sending me photos, proud that I have been a friend of theirs for many years, proud that I've been a pediatrician to their children, that now people are getting both shots together. It's a good thing. And one of the most important things is it potentially limits the number of times you need to see your primary care doctor to receive that vaccine in the medical home, which we know is very, very important.
I'm guessing the answer to this one is no, but I'm going to ask it just to clarify. For the person who gets both the COVID and the flu vaccines at the same time, will they have more side effects than if they just got them separately?
I'm sorry. Yes, I think there is a potential for that, though I have not seen it with our patients thus far. We have been giving the COVID vaccine to our patients 12 and above now for several months. We have not seen any change recently as some of our patients are now receiving their seasonal flu vaccine. This may not be a case where 1 + 1 = 2. This may be a case where one little reaction of soreness in an arm, one little reaction of malaise, fatigue, low-grade fever, doesn't come together to be a whomping effect. But I would expect that some people will react, and that may be a good thing. It may actually be showing us that the body's immune response is turning on, and that may show us how well they are accepting the vaccine and now are prepared for the coming season, which may be very, very bad with respiratory illnesses.
Very interesting. I heard they're coming out with a combined COVID and flu vaccine. Should I wait for that to be available before I get immunized?
Well, that is a question within a question. We know that Moderna is working on a combination vaccine that includes COVID as well as the seasonal flu. We do not know when their studies will be out, and we do not know what the FDA and the ACIP will say about that. We also know that Moderna is working on a combination vaccine to include RSV, or respiratory syncytial virus. But I think the bigger question is, many of us have already received our COVID vaccine. Right now, Moderna is not licensed as a booster. This may be their entree into the booster to say, okay, now we have studies that show that this is a booster because you already received your 2 Moderna vaccines starting back in the early part of this year. This may help us going forward. But my recommendation would be, don't wait, walk, run and get your vaccine right now.
So we know that you are a pediatrician, so we have to ask, is the information we've just discussed about the COVID and the flu vaccines the same answers for children as well as for adults?
Yes, Amy, this has been something that's been a hot topic with pediatricians all through the country. I have friends that practice in San Diego, up in Maine, up in Portland, down in Miami, all over the United States. Many parents are a little nervous about new vaccines, new technology. Should my child receive vaccine A plus vaccine B? We have many parents that want to split their vaccines. Pediatricians wear a stethoscope, have been to medical school. We're not the ones that are broadcasting information that we don't have full knowledge of. So yes, I have many parents that query this every single day. We are the medical home for these children. These children are our future. These children are my grandchildren. I know that it's very important to give parents, guardians, caretakers, and even some of the children that say, Dr. B, is it really safe? I really want this. My mom is not so happy. Dad is. And we have to navigate that and help steer this ship to hopefully get children vaccinated and get children and their parents and guardians vaccinated on time. This could potentially be worse as far as illness. This could potentially be a devastating season as we head through the fall into the winter.
Well said. Do you have any final words of advice for parents?
Yes, I always have something else to add.
Good to hear.
I think it's important for parents to query us and ask us those questions. We are their medical home. We've been there for their children from the time they were born. Most pediatricians look at these children as if they're our own. We would do nothing to harm our own children. We would do nothing to harm their children. We are the people that help to keep these children healthy. They are the next generation. They will be the people that take care of us. Many of these children may turn out to be physicians. I may end up asking them advice as I get older and they get older, and now they are my sounding board. They are my medical home. And the other thing is, please vaccinate and vaccinate on time.
Thank you so much, Dr. Bienstock, for this very useful and timely information. For more answers to questions about the flu or to find influenza immunization clinics and sites throughout New Jersey, please visit our website, powertoprotectnj.org. Remember, you have the power to protect yourself and your loved ones against the flu. Thank you.